Hi, I am Dr. Parthiban, consultant dermatologist and trichologist, practicing at Lifecare Medical Center, Coimbatore. Today I am going to talk about hair loss and how to take care of it. Almost 30 to 40% of people who come to our clinic comes with complaints of hair loss, and before coming to us, they go to internet, they try all kinds of products, and without seeing the results, they come to us. The first thing in treatment of hair loss is we have to identify what is the underlying cause and treat it accordingly. Not all hair loss needs the same kind of treatment. It varies from condition to condition. First, we have to know what is hair loss and what is hair shedding. Say, hair shedding is the normal process. The hair undergoes 3 stages, anagen, catagen and telogen, before it sheds off. So each and every hair will last up to 4 to 5 years. After that, it sheds off and you get a new growth. So this is called hair shedding, and you don't need any treatment for this, and you don't need to come to a doctor for this. The next one is hair loss. Say, hair loss can be because of various factors. It can be because of hormonal factors, it can be because of genetic factor, it can be because of aging factor, and it can be because of any medical issues. Hair loss, it can be temporary or permanent, and hair loss treatments also varies depending on the types of hair loss. Say, we have 3 types of hair loss. Say, androgenetic alopecia, that is the most common cause of hair loss in both men and women, and it can occur equally in both men and women, and this is what we call it as baldness. See, this can be mainly because of 2 factors, the genetic factor and hormonal factor. There is a hormone called DHT, that is the dihydrotestosterone, which causes this kind of hair loss, and the treatment depends on the severity. So there are a lot of stages in this pattern hair loss, and treatment depends on the stage the patient present to us. The first treatment will be the medical treatment, where we give topical solutions and tablets to control it. The second will be the PRP injections. Then we do have laser therapy, and we do have hair transplant surgery. So hair transplant surgery comes when the patient doesn't show any results to the medical treatment or PRP injections. The next thing is Alopecia areata, which is an autoimmune condition. The exact cause for this is not known. What happens here is your body's immune system will start attacking your own hair roots. So this comes as 3 stages. Alopecia areata is where the people will be getting 2-3 patches of hair loss in their scalp. Alopecia universalis is like they lose hair all over the body, including eyebrows and eyelashes. Alopecia totalis is where they lose hair only in the scalp, and the treatment is totally different from the pattern hair loss. We call it as immune modulator tablets to control this and to stimulate the growth. The last condition is Telogen Effluvium, which is the most common type. In Telogen Effluvium, there are various factors which is involved. It can be because of stress factor, it can be because of lack of nutrition, and we see a lot of kids these days going for crash dieting for weight loss. It can be because of any medical illness, it can be because of thyroid issues, hormonal issues, any surgeries. Nowadays we see a lot of hair loss because of COVID-19. So all these conditions can cause telogen effluvium. So the treatment is we have to identify what is the underlying cause and treat it. Along with that, we give hair supplements to treat it. And this can be reversed, and it is a temporary form of hair loss. So first I like to share a few do's and don'ts about hair care. First thing is diet. Say, diet plays a major role in hair care. So take foods which is rich in proteins, vitamins, carbohydrates and minerals. The second one is sleep pattern. Like you need at least 7 to 8 hours of sleep. And the third one is the stress management. And wash your scalp at least twice a week. And if it is too oily or if you are exposed to too much of dust, then you can do it frequent hair wash. Coming on to don'ts. The first thing is avoid overheating of hair, because we see a lot of people using hair dryers, a lot of girls doing hair straightening. So too much of heat can cause hair loss, and sometimes even the UV radiation from sunlight can cause hair loss. So whenever you are going out, you can cover your scalp with a cap or a helmet. Don't over pull your hair, because that can cause traction alopecia, because a lot of people, they pull their hair too much when they style it. So don't give too much of traction, and if it is frizzy, you can use a conditioner, otherwise you don't need any conditioners. And mainly men avoid smoking because smoking can cause premature graying and early baldness, because that can cause vasoconstriction and there will be decreased blood supply to the root. So whenever the hair gets a good blood supply, the growth will be better. So avoid smoking. Thank you.